Sweetser, one of Maine's largest community mental health providers, is vying to develop the state's first psychiatric residential treatment facility for kids and youth with severe mental health needs.
The 16-bed facility would provide round-the-clock care in a secure setting, and advocates say it's a crucial step forward to try to fix a broken system. News Center Maine's Vivian Lee has our update tonight from Saco.
This 8,000-square-foot two-story building on Sweetser's Saco campus could be the new home to Maine's first psychiatric residential treatment facility, or PRTF. Sweetser is competing with other nonprofits and behavioral health care providers for $2 million in capital funds. That funding would be used to retrofit the building, which currently houses residential units, into a secure 16-bed facility. Sweetser President and CEO Jane Von Bremer says the nonprofit is submitting an application after DHHS officials said it would offer sustainable Maine care rates. She says the facility for children and youth under 21 with severe mental health issues will have psychiatrists, clinicians, crisis workers, and nursing staff available 24/7.
A lot of interventions to work with the children and their families, so there'll be family therapy.
Von Bremer says the facility could help bring home some of the 70 Maine kids in treatment facilities as far away as Arizona.
It will allow us to prevent kids from going out of state, and it will allow us to take kids out of ERs that are...
Katie Harris is the Chief Government Affairs Officer for Maine Health. She says the state's largest hospital system is grateful that establishing a PRTF is closer to becoming a reality, as 120 children remain on a waiting list for an inpatient bed in and out of state.
Those children are languishing in the wrong care settings as a result of the lack of access to residential treatment.
Over the last 5 years, Maine has lost more than 150 beds in programs that treat kids with mental health problems and special needs. Last September, Maine Health Spring Harbor Hospital closed its 12-bed behavioral health unit for children and youth with developmental and intellectual disabilities. Harris says it will reopen sometime in the future with a new care model.
And it's going to really be more effective and efficient in the care that it provides.
Jessica Reed's son Brody is nonverbal and is on the autism spectrum. She says his severe behavioral needs leave him in continuous crisis. He's currently waiting for a bed at a residential treatment program in Maryland, but she is hopeful a PRTF means he could stay in Maine.
They will be able to keep him safe easier. They're well equipped to do that, to keep him in a safe environment, to keep him regulated. I would consider putting him there for that reason.
The deadline to submit a proposal is later this month, with DHHS expected to announce the recipient of the capital funding sometime in April. In Saco, Vivian Lee, News Center, Maine.
Sweetser has been awarded a $2 million contract to build a new facility on its Saco campus.
The building will be the first of its kind in Maine, designed for children needing intensive care that may pose a risk to themselves and others.
That's the ultimate goal, is to serve these youth in their most natural setting out into the community. But for these particular youth at this higher level of acuity level, they really do need such a facility.
Sweetser is aiming to have the facility open in April.
We will prevent them from running away, from being trafficked, from, getting involved in potentially criminal activity.
Sweetser CEO Jane Van Bramer says with monetary help from the state, her company is planning to open Maine's first secure psychiatric residential treatment facility for children. She says it's filling a hole in Maine's care system, since currently about 70 Maine kids are receiving this type of care out of state.
These are for the kids that nothing else has worked for.
Work is now underway on Maine's first psychiatric residential treatment facility for children and youth on Sweetser's 200-acre campus in Saco. The secure facility will help address a crucial gap in mental health services and allow kids currently in out-of-state treatment facilities to return home.
However, critics are arguing that placing kids in crisis within a locked facility does not resolve the issues related to Maine's broken mental health system. News Center Maine's Vivian Lee has our update.
Crews are clearing out furniture and renovating an existing residential unit on Sweetser's Saco campus. It will be the site of a psychiatric residential treatment facility, or PRTF, and will have up to 16 beds for children and youth with mental health needs.
And we'll have a secure outdoor area so the kids can go outside and have access to fresh air.
Sweetser CEO Jane von Bremer shows us the plans for the 8,000 square foot building, utilizing $2 million in funding from the Maine Department of Health and Human Services. Establishing a secure residential program comes after an agreement with the U.S. Department of Justice, ending a federal lawsuit that alleged Maine unnecessarily segregated children with behavioral health problems and disabilities in hospital emergency rooms and treatment facilities as far away as Utah and Arizona.
We don't want to just bring kids home and replace them with other kids. We want to stop kids from going out of state. This is their home. This is where they should be served.
Nancy Cronin is the executive director of the Maine Developmental Disabilities Council. She and other disability rights advocates say a locked facility could put vulnerable children more at risk for potential abuse. They also want the state to prioritize rebuilding its network of community-based services.
How are we systemically moving so that children can get their needs met at whatever level of care they need? And this has to be much bigger than 16 beds.
According to a DHHS spokesperson, the PRTF will provide a level of care that is not designed for children with intellectual and developmental disabilities. Jessica Reed's son, Brody, is on the autism spectrum. He is nonverbal and has severe behavioral needs. The 13-year-old has been on a waiting list for a residential program in Maryland, but his family would much rather have a placement for him in Maine.
They're only addressing one certain part of the population when there are still hundreds of kids that are in crisis, like Brody, that have nowhere to go, not in state, not out of state, not anywhere.
Last September, Maine Health Spring Harbor Hospital closed its 12-bed behavioral health unit due to repairs and staffing issues. The only unit in the state that accepts children and youth with developmental and intellectual disabilities. Kelly Barton, the president of Maine Behavioral Health Care, tells News Center Maine that by June, the facility will have converted all of its beds to private rooms, which will expand capacity to 30 beds, including for patients with special needs.
Kids won't necessarily be placed on a specialized unit, but we will still be admitting those kids to the hospital.
The locked program could open its doors in April of 2026. In Saco, Vivian Lee, News Center, Maine.
Sweetser could begin accepting referrals for treatment next spring. Placements for children with Maine Care will be prioritized.